Now, we've all heard of Invisalign. I know I've heard it. We see the ads for it everywhere. But do you know what exactly it is or if you're eligible to get it? Well, here to tell me just a little bit more about Invisalign is Dr. Brian Dugoni, an orthodontist with Rodeo Dental. Good morning.
Good morning.
Thank you very much for being here today.
Thank you.
So, Dr. Dugoni, tell me a little bit about, we've seen a lot of people who want straight teeth, but they don't like the idea of braces, I guess, let's say.
Absolutely.
So tell us a little bit about Invisalign. How does it work? And, how does it work?
Yeah, so basically Invisalign, it's kind of a new modern approach to braces, geared mainly towards teens and adults, so not really for the young children. And what it does, it gives adults that beautiful appearance while straightening teeth without the metal. So you always hear that quote-unquote metal mouse. So this really gives that away from, gets it away from that. What the Invisalign is, it's actually clear removable trays. You wear one for 2 weeks and then you change to the next one. And every 2 weeks your teeth are getting straighter and straighter, slowly but surely. One of the beauties of Invisalign is that it's something you can actually take in and out. So that means you can keep up with your same brushing and flossing and chewing and eating that you normally do. But you just got to remember, it's got to be worn 22 hours a day, so you got to put it right back in. 22
hours a day. Well, that doesn't seem too bad. I mean, braces you have to wear all the time, so this doesn't seem that bad. So I guess now is Invisalign, a good option for everyone, or because I know you said it wasn't really for kids, it's more towards adult and teens. But can anyone get Invisalign?
Almost anyone.
Okay.
So if a case is extremely severe, traditional braces may be the best route for you. There are different types of braces that may be a little bit smaller, a little bit less visible, but Invisalign for the most part can be worked on everybody, but like you were saying, not on small children. So
yeah, of course. Now, I guess, what are some of the advantages and disadvantages of having Invisalign? Because you said they have to be worn 22 hours a day, but what are some of the other advantages and disadvantages to it?
So the overall beauty and advantage of Invisalign is the fact that you can't really see it. Mm-hmm. Hence the name Invisalign, pretty much invisible. So that's probably the number one thing that most people head towards Invisalign for is because you can't see it. One of the major kind of disadvantages is sometimes you can't really treat those really severe cases like we were talking about. Mm-hmm. Other than that, I mean, it's a beautiful system that works pretty much on anyone.
Now, I have another question. Now, I know that there's some people that might have like a little gap in the teeth, or maybe one tooth that's crooked. Should they also be able to consider Invisalign, or should they consider Invisalign as an option?
Absolutely. Invisalign is absolutely fantastic for those small little corrections. It's quick, it's easy, and it's perfect. It's absolutely perfect for those situations.
And of course, Rodeo Dental would be able to help everyone out in those needs. Now, do you know about how many Invisaligns? Do you know how many Rodeo Dentals there are out there in the Rio Grande Valley?
In the Rio Grande Valley, I believe there is 8 now?
8 now. Okay, great. So, of course,
sorry,
6.
What are you saying?
There are 6. There are 6 Invisalign. He has a fellow doctor here who's helping him out. But there are 6 different Rodeo Dentals, and of course, any of them would be able to help us out and answer our questions in case we don't really know much about Invisalign, right?
Absolutely. Come and see us, and we'll be right there to kind of answer any questions and kind of guide your treatment, give you that best, beautiful smile that you're looking for.
Now, I remember when I was younger, every time I would go to the dentist, they would give us a lollipop at the end. Do you guys still do that or no?
We still do it, but don't worry, Mom and Dad, and everyone out there, those lollipops are made of xylitol, which actually helps prevent cavities, so there's no sugar in those guys.
Awesome. You know what, Dr. Brian, thank you so much for coming by and I guess explaining a little bit more about Invisalign, because I've heard of it, but I never knew exactly what it was about. So I really appreciate you coming by.
Absolutely. Thank you.